Okay, so this is going to be deaccessing a CVC port. Some things we're going to need for this procedure: heparin flush, saline flush, alcohol pad, chlorhexidine prep, gauze, and a band-aid. We're also going to need a mask for ourselves and for our patient. If you can't tolerate a mask, turn his head sideways. We're going to knock. We're going to look at our orders, look at our facility policy for this procedure, and then we can get started. So during this procedure, let's start by knocking. Hi, Mr. Johnson. My name's Josh. I'm going to be taking care of you today. I saw that you had a order in to deaccess your port. Is now a good time to do that? He's going to tell us yes, we're good to do that. We would raise the bed up for good body mechanics, do hand hygiene, provide for privacy. We verified our patient. What else? Oh yeah, this bed does not lift up, but we would raise it. And we're just going to start by putting on a pair of clean exam gloves, and we're going to loosen the dressing on each side. After we've got it loose, we're going to go ahead and take our alcohol pad, clean off our lumen, not lumen, but Lurlock port, and we're going to attach our saline. We're going to aspirate for blood return, and then we're going to flush in a push-pause motion for 9.5 mLs. So after we've flushed with 9.5 mLs, we're going to clamp again, grab another alcohol pad, scrub for 15 seconds. Then we're going to take our heparin flush, we're going to attach it. We've already aspirated blood return and flushed with 9.5 mLs of normal saline. So now we're going to unclamp our line, and we're going to flush in a push-pause method with 4.5 mLs of heparin. Not 5, but 4.5. That way, in case there's air in there, we don't put air in our patient's port. So we're going to clamp our line once again after we flush with saline and heparin. And we're going to loosen the dressing on all sides. We're going to stabilize the port with one hand, and then we're going to just grab all of it at once and take it out. So we've got our dressing and our port, and it's all out. Then we would take our gauze if we need it, if it's going to bleed on us any, which most of the time it won't, but we would stop the bleeding with our gauze. And after we're done with that, we would take our chlorhexidine and clean in a basket weave motion. So throughout the entire area. And then we would place a band-aid over the dressing. We're going to teach our patient to not soak in the water, or don't take any baths for 24 hours. We're going to teach him signs and symptoms of infection. We're going to look at the area. We're going to document the condition of his skin if there's any abnormalities. Condition of the skin if there's any abnormalities. We're going to document the procedure. Bed in lowest position. Hand hygiene, dispose of this in the sharps container, and then we would be done.